Carly wants a chin. Now that you saw Carly get her chin, is there something that you want? We're back with Dr. Solomon, and he's going to give us a quick rundown of all the different options available to you for facial plastic surgery.
So we're going to talk about your face, and we're going to divide it into different areas. So when we're looking at the upper face, we're looking for lines in the forehead, which you don't really have. You're starting to get just a tiny line here. Also, you can get vertical lines here. And over time, what happens is the eyebrow can start to descend and cause hooding. There's two main procedures available, and those are called brow lift procedures.
So it's a
full brow lift. The other types of procedures are newer, are called endoscopic brow lifts. So instead of one big incision, you make a few smaller incisions, and then you use a little tiny camera or a telescope to go into the area, cut the muscles with using a camera and a TV screen, and then lifting the brow and using hooks to actually support the brow in a new position.
How many incisions total usually?
Usually it's 3 incisions.
What's the healing time on that?
It's still a number of weeks you look beaten up and swollen. Some people, you need to lift the brow slightly and then still tailor a little bit of the upper eyelid skin. And then it's basically trimming the redundant skin, and then there's little tiny sutures are used to close the incision. Healing time's quick. Usually within a couple weeks you look reasonably good, but there is a little scar, and that can take a month or two to really start to fade. There's the bridge of the nose, there's the width of the nose, there's the shape of the tip, and there's also the width of the nasal base as well. And then finally, the last thing, and this is called the columella, which makes up the tip as well, and in some cases it hangs down. So you have a nice nose.
All that can be altered?
All of those things have potential to be altered. There's what's called closed rhinoplasty, where all the incisions are made inside the nose. There's open rhinoplasty, where a small incision is made across the base of the nose. Your bump on your nose is probably right at the junction of where the bone and cartilage meet. That can be rasped down. Sometimes we actually use little scissors to trim where the cartilage and bone junction meet. So different instruments depending on what's actually being modified. For bones, it's usually chisels and rasps. For cartilage, it's usually either a knife or a scissors.
All right, upgrades on the cheekbones.
People not only need lifting, but they actually start to need filling. If I were to exaggerate, it's hard to even do, it starts to drop over time. And we start now doing filling in this area. We start reshaping and filling it. Cheek implants can be divided into two categories. They can either be augmenting the actual malar eminence, the actual part of the cheek that's the bony prominence of the cheek, or they can be submalar, or actually augment the middle part of the cheek here, where some people are somewhat flat looking. Now we're into the lower face and mid face combined, and neck. I'm going to deal with these three regions all together. The lower face and the neck as you age do descend. You have no signs of that at all at this point. But what happens is you do develop what's called jowling. You get a bit of a sag there, the cheeks flatten out, and the neck may develop little lines and redundancy. So all of those things could be potentially surgically addressed with what's called facelift surgery. And the incisions are made just in front of the ear, behind the sideburn. Sometimes it goes around the sideburn or through the sideburn up into the hairline, and it can wrap around the ear and go behind and follow your hairline at the back of your neck. Now when you start getting into the neck lift combined with facelift, the incision has to go further back. The dissection then comes all the way out to here. In many cases, make a separate incision underneath the chin so that we can actually tighten the muscles in the midline, because there's two muscles that run right down here in your neck. People are looking to stay looking young and refreshed rather than allowing themselves to start aging and looking old and then trying to reverse the clock.
How is someone to know when they should start, what they should start with?
I think everyone's different. I think everyone ages differently. Some people you see that look much older than their stated age. Some people look younger than their age. So there is variability. I think everyone should try to have consciousness of